pediatric procedures. Bathing. Start at the face, wash, rinse, and dry, exposing one limb at a time. Dry skin folds correctly. Perform good perineal care. Always dry skin correctly. Wash from front to back. Cover up after to prevent chilling. Before feeding, test the temperature of the milk. Hold bottle upright with no visible air bubbles. Burp after to prevent colic and aspiration. Same concepts apply when breastfeeding. When foods are introduced to toddlers, start one food at a time to make sure food is bite-sized to prevent choke. Therapy. Oxygen therapy helps improve the child's respiratory status by increasing the amount of oxygen in the blood. Check oxygen levels every 2 hours. Nasal cannula is most commonly used with infants. Suctioning. Signs that child possibly needs suctioning: pallor, anxiety, increased pulse, respirations, and nasal flaring. Depth approximately 1/4 to 1/2 inch beyond the tip. Limit suctioning not more than 5 seconds. Allow 30 seconds between the suctioning. 2 or 3 attempts at most. Intake and output. All fluids given to a child are documented on a record kept at bedside. Most hospitals require routine weighing of diapers. 1 gram equals 1 ml of urine. Administration. Always follow the 6 rights of medication administration. Right medication, right amount, right patient, right time, right route, and right documentation. Oral meds. Use spoon, plastic dropper, or plastic syringe. Make sure to prevent aspiration. Sit child in a semi-reclining position. Other routes: intradermal, subcutaneous, and intramuscular medications. Intradermal, ventral arm, you use a 25 to 27 gauge needle. Subcutaneous, upper arm, lower abdomen, and anterior thigh, use a 23 to 26 gauge. Intramuscular, 0 to 2 years old, vastus lateralis, ventral gluteal, 5/8 of an inch. Collection. Suprapubic bladder aspiration, performed by qualified personnel. 20 to 21 gauge needle inserted into the bladder. In supine position. Best time for procedure is 30 to 60 minutes after voiding. Collection bag. Clean area and dry properly. Give girls special attention to vagina and rectum. Monitor child for voids. Catheterization. Occasionally used. High risk for contamination by introducing organisms into urinary system. Lumbar puncture. Explain procedure to parent and child. Apply EMLA anesthetic to lumbar area 1 hour before procedure. Position patient at edge of the bed on the side or sitting position. Lie flat for several hours to avoid headaches in adolescents. Venipuncture. To obtain blood specimen. Physicians sometimes use jugular or femoral vein to obtain blood specimens. Holding the head or lower extremities absolutely immobile is crucial. Place child in a mummy SRD. Have shoulders at the edge of table and